Welcome and thank you. Welcome and thank you for joining us for the Navigating the Workplace with PI session. Happy to share. We've got about 40 people, I think, in the meeting, which is fantastic. Thank you all for being here. I'm going to just clarify one more time that this session will be available in Spanish. If you are interested in listening to the session in Spanish, you can navigate to that by clicking on at the control panel. There's a globe, and you can access the Spanish language line by clicking into that toolbar. And if you have any questions of that, you can also send that into the chat. As we go along, I will be taking questions at the end. So if you have questions that pop up, you can enter those into the chat as well. And I will have time at the end to go through questions with everybody. And hopefully we can answer questions that you may have about the workplace and a couple of common HR laws. So welcome again. And one other quick note, there is somebody in the audience listed as the technician. That person's here to assist with the recording. They're not the IT help desk. If you have any problems with your connection or anything related to IT, there is an IT help desk that you can access on the attendee hub, and there's people there that can help you with connections at that point. So if there's no other hesitation, I'm going to dive in. And again, thank you all for coming. So I always like to start off just about any presentation I do with the mission statement of IDF. Just as a reminder, I think everybody here knows who we are. So I like to point out that we are here to improve the diagnosis, treatment, quality of life of people affected by primary immunodeficiency through fostering a community empowered by advocacy, education, and research. So in this presentation, we'll touch base on a couple of things, including different ways that we advocate in the education that we can provide you related to working with PI. Looking forward to sharing everything. First and foremost, my name is Chris Duckett. I'll be the host for today's session, and I am the Director of Talent Management for the Immune Deficiency Foundation. I am also the volunteer coordinator, so I am privileged to get to work with all of my coworkers here, and then also well more than 400 volunteers. Now that number is probably closer to 600 right now, which I'm very excited to share, but I like to say more than 400 just because it makes sure we capture that number pretty well. A little bit about me. I've got more than 20 years in the human resources field. I'm pushing up against 25 right now. I started my career in talent acquisition. I've worked in just about every area of human resources, including employee relations, employee engagement, benefits, HRIS administration, data analysis, been in multiple industries, and I've sort of found my home working in the nonprofit medical related fields. I've worked in the transplant industry before coming here and have really enjoyed my time here with IDF. And with meeting all the fantastic people that I've met. So what does this all mean? And there's a lot more in that introduction, but it always feels a little weird to me to actually read my own introduction. So what I love about being here is that I have the honor and privilege every day to help and work with people just like everyone on this call. I am often amazed when I hear your stories. The perseverance, the caringness and willingness to help other people is just overwhelming every day. So before I go any further into this topic, I want to make sure I take a moment to thank every single one of you for allowing me to be here and for letting me share this information. And kudos to every single one of you for being here and allowing me to be here. So again, thank you. If there's anything ever I can do for you beyond this presentation, by all means, feel free to reach out. So again, thank you. Now, you've heard multiple disclaimers as we've gone into the presentations, and I'm going to do a couple here real quick that we have to do on every presentation. So first and foremost, the one we've all heard is the information presented during this session is not medical advice, nor is it intended to be a substitute for medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health providers with questions concerning a medical condition. Now, that's the medical release. We will probably not get a lot into medical terminology. However, I do like to point this out. We're going to be discussing employment laws and practices that we will get into. There are federal laws and state laws. The general gist of that is the federal government provides overarching high-level laws, and then the states can put policies in place to exceed those laws. We do not have time in the time today to get into every single state law that exists and how they interact with federal laws. So we're going to stay pretty high level in the federal arena. One example I like to point out, for example, highlighting this is California. The state of California has a lot of laws that exceed federal requirement. the one that's most employers deal with is the hourly employees. Overtime for the standard for the country is that you get paid overtime for anything more than 40 hours in a week. The state of California says you're required to pay paid overtime for anything more than 8 hours in a day. So just that subtle difference has a pretty big impact on the way employers have to calculate payroll and a number of different things. And last, I am not an attorney. I am a 20+ year HR professional. So while I do have a good understanding of the laws, I am not here to provide legal advice, but I'm happy to at least point you in the right direction if you have questions. So that's what this is about. I'm fortunate enough in my career to have seen, obviously, these HR laws from both sides as the employer, but then also as an employee, obviously. I have applied for jobs just like everybody else has. I have been through the interview process just like everybody else has, and I've also been the one doing the interviewing. One last thing I'd like to point out, we are going to talk about different laws that have an impact on our community. And while I personally do not have PI, I am a person with an underlying medical condition that most people wouldn't know just by meeting me. So I do have a little bit of experience navigating the workplace as having an underlying disability, which we're going to talk more about. So happy to share my experiences as well as what you can expect as a candidate in the workforce. Okay. So today's agenda, my goal today is to provide a high-level overview of some common employment laws and practices that give you at least a basic understanding of what you should be seeing. You remember in the session it said 25 minutes. Well, we may go a little longer than 25 minutes, and the Q&A session may go a little shorter, but I think you're going to find that what I'm trying to cover is going to be helpful, and I'm happy to answer questions after the fact. But we will get you out of here on time. There's some exciting sessions going on at 5 o'clock. And again, I'm always available because I am an employee of IDF. I'm always available after the fact. So we're going to go over applicable federal laws. We're going to talk a little about some common terms and philosophies that associate with those laws. Employer interactions. We're going to talk a little about what you can expect from your employer related to things like accommodations. Employer benefits plans. This is going to be just touch base on very quickly, but just giving a high-level overview of what is required by law that your employer offer you. And then we'll have an open Q&A. So I'll happily answer some questions and see if I can get you pointed in the right direction if there's anything that I can help you with. So that's where we're going. So let's dive in. So I think just about everybody here has probably heard of the Americans with Disabilities Act. I like to highlight this a little bit because there's a lot of components of this that people, I guess, don't always have their head wrapped around. They don't always understand some of the requirements and some of the things, the protections in place for the employer, but also obviously the employee. So the Americans with Disabilities Act came out in 1990, and it prohibits discrimination in job application procedures, hiring, advancement, or discharge of employees, employee compensation, job training, or other terms, conditions, and privileges of employment. So basically says you can't discriminate against somebody because of a disability. They point out this can be a confirmed or perceived disability. And that's perceived disabilities is pretty vague terminology, but I guess the point here is that it's pretty open when it talks about disability. It introduces a requirement for employees to make reasonable accommodations, and we are going to spend a little time on that as we go. And this applies to employers with more than 15 employees. So it's not every single employer, but anybody with more than 15 employees is required to follow the terms of the American Disabilities Act. So what are the protections? Cannot discriminate, cannot harass, retaliate, divulge confidential information, or fail to consider requests for accommodations. Now, what is a reasonable accommodation? This is also something that we bring out, and we'll get into more detail about this, but reasonable accommodation is any modification or adjustment to a job, policy, or work environment that allows the individual to participate equally without creating an undue hardship for the employer. Okay, undue hardship. What's that mean? What is an undue hardship? Well, we will get to that in a couple of slides. This can vary, and it's one of those things, unfortunately, that can be set in mud, so to speak. So we will talk about what that means and how we negotiate through and what things are in place there. Okay, so we're going to jump to the next slide here. Now, with the Americans with Disabilities Act, there was an amendment to that. So the Americans with Disabilities Act Amendment Act, so the ADAAA, started in 2008 and further and more clearly defined many components of the Americans with Disabilities Act. So what does it mean to have a disability? This is something that is defined, because I think I don't need to tell anybody in this room that oftentimes what we work with are what are considered to be invisible illnesses. You know, everyone has probably had somebody say, well, you don't look sick. Well, thank you for that. But the reality of it is there is an underlying condition here. So a disability is defined as a physical or mental impairment that substantially limits one or more major life activities of such individual, or a record of having such an impairment or being regarded as having an impairment. So the definition explicitly mentions major bodily functions, and here's the part I like, includes the immune system as examples of one or more major life activities. So if your immune system does not function properly, under the definitions of the ADA, you can be considered disabled. So like to just put that on the table because it's pretty clearly defined, and most people here would consider that disabled. Now, I do like to point out that, you know, in all reality, if I say to myself, okay, I'm disabled, what does that really mean from a workforce perspective? And again, we'll get into a little more detail, but in all reality, it shouldn't change much. You know, there's a process by which we talk about accommodations. There's a process by which we define the essential functions of a job, which we're going to do here in a minute. But it really doesn't change a whole lot from day to day if you can do the job. That's the key component here. And it also, like I said, it puts into place the idea that an employer should seek to find a reasonable accommodation. And that's going to be what we're going to dive into next. A couple of other quick little things here. I apologize. We'll get into the reasonable accommodation in a second. Another couple of other laws, and I have to admit, this is probably one of my favorite laws from an HR perspective. As I pointed out, that I've seen both sides of this. I've been on the employer side and the employee side. And this is one of my favorites because of the surface. I think this is one of the laws I personally believe is one of the most fairly written laws from both perspectives, but has some nuances to it. So most people here have probably heard of FMLA. It applies to both the patient and the caregiver, immediate family members. This is important. So what FMLA does, it provides up to 12 weeks in a year or up to 480 hours of unpaid leave for a serious health condition. Now, eligibility for this, and this is where I'm going to point out that some states have better eligibility than this. What they mean by that is that some states have eligibility for a leave that is faster than 1 year after employment. Sometimes you're eligible after 6 months. Some states will even bump this up to 3 months. So this is one where you have to sort of do a little research into your own state specific role. So if we go by federal law, eligible after 1 year employment, 1,250 hours worked, applies to employers with more than 50 employees. That's also varies by state. But the more robust policy basically says that if you have been there for a year, you can take a leave of absence for up to 12 weeks to recover from an illness or for an illness. If you are a caregiver, so that sometimes that caregiver is defined as immediate family, so brother, sister, husband, wife, of somebody who has an illness, and they have to protect your job. So what that means is that you can leave. Only has to be unpaid leave. They provide you with the leave, and they have to hold that position for you so that you can return to it when you're done. So this next comment, though, that I like to point out that a lot of people don't really have a good understanding of is the concept of intermittent leave under FMLA. So you don't have to use that 12 weeks all in one block. Quite frankly, if you have the documentation from your physician, and what that FMLA needs to be is 5 hours per week to receive recurring treatments, then as long as you met the qualifications under FMLA, then that can be approved as an intermittent leave under FMLA. Now, you'll have to provide the documentation to go with it, but this is one of those nuggets that most people don't really realize is out there. It's a protection for them under FMLA. So if it's yourself that needs the time off to get treatment, your employer has the right to ask for that proof, but they also are going to look at a way to manage to count those hours. So if you think about 5 hours per week, however long it takes to add up to 480 hours, that could be the end of that approved leave. But most likely, you're going to be into a new year. So it could be an ongoing thing under intermittent FMLA. You have the right to that for yourself. If you have an immediate family member who has to undergo treatments, this also provides you the right to have that leave to care for them or take them to those treatments. So FMLA is a great program, and again, often very misunderstood. And I'm sure that I could probably spend the next hour and a half talking about the nuances or giving you case law and examples of FMLA. But this is something I like to point out in this crowd because I think a lot of folks don't understand the intermittent FMLA application. Now, like I said before, some states change the eligibility for this and they make it sooner. So in your own particular situation, you may want to look at your own state. For example, Maryland has a thing called Family, which is a leave act that Maryland has. And they've actually even made it a paid leave, which is fantastic. They have a paid leave insurance that covers some of the cost of that leave to the employee directly. So, but under FMLA, it only has to be an unpaid leave. An employer can say you have to use your paid vacation or paid sick time in accordance with that, but the actual leave only needs to be unpaid. Okay, so some other applicable laws that kind of we get into here when dealing with the employment work is EEOC. We have obviously prohibits against discrimination against defined protected classes. We have the ACA, the Affordable Care Act, which provided standards for coverage of healthcare, which we are going to talk about in a future slide. HIPAA and GINA. HIPAA is something most people have heard of, but a lot of people don't know what GINA is. HIPAA is, just as you can imagine, it's the Health Insurance Portability and Accountability Act. The biggest misconception related to HIPAA is who's covered by HIPAA regulations. Most employers are not HIPAA bound. HIPAA is something that is designed to be covered by healthcare providers and to protect your healthcare information. Employers do not usually fall into this unless they have an employer-sponsored health plan. So if they actually are like an employer is self-insured, then some HIPAA components apply to them. GINA is the Genetic Information Non-Discrimination Act. And again, not something that most people hear about a whole lot, but it protects you from discrimination based on your genetic information. So if your employer were to somehow become aware of your genetic history, this prevents them from discriminating against you in any way, shape, or form related to that. And then the predecessor to the ADA, which still shows itself every once in a while, is the Rehabilitation Act of 1973, which applies largely to federal workers. So a couple of other nuggets there that are all still floating around, but something to be aware of as we move forward. And again, we could talk for hours about each of those. So some common terms and philosophies that I like to point out. And this is different. And I think that I like to point these out because as we go forward and we talk about more things, there's some components here that we have to be honest with ourselves about. Qualified person. You will hear this term thrown around, especially when you start talking about, the ADA and accommodations. A qualified person is somebody that must be able to perform the essential functions of a position with or without a reasonable accommodation. Now, understanding that within that sentence, there's a couple more definitions. One being essential functions. You will most likely find, if you were to go to your employer right now and ask for your job description, the primary components or responsibilities or duties of your position should be spelled out in your job description. That means, what are the things you have to be able to do? How is your job measured? What is the success? What are the responsibilities there? Now, you are a qualified person if you are capable of performing those responsibilities. Now, this comes into play and is very important as we talk about applying for jobs, and we'll get into that in a couple more slides as well. So, essential functions, you have to be able to do those to be considered qualified. Now, the reasonable accommodation part, as we brought this up previous slides, it cannot cause your employer undue hardship. Okay, so reasonable varies upon the request and size of an available resources of the employee. So let me give an example of this. This is just a pretty straightforward, just a hypothetical. If you are one of 20 accountants at your employer and you need to have, as part of an accommodation, you need to be able to change your schedule so you can leave every Friday at noon. Well, if you are one of 20, and in that circumstance, maybe that's perfectly okay because there's plenty of other people that can be there, that can adjust the work, that they can move the work to if you are going to miss things. That might be simple for that employer because you're one of so many. Maybe you're one of 55 employees in your workforce and you're one of only 2 accountants. Well, leaving early that day may be unreasonable. That may be something that's harder for your employer to accommodate because you are only one of 2 people, or maybe you're the only person that could do that job and the job requires that you be available on that time and day. So again, reasonable and unreasonable can vary. And this is why there's a thing that we're going to talk about here coming up called the interactive process. So it can vary by employer. It can also vary based on cost. What's the cost of the accommodation? So a lot of moving parts here, but we're going to talk about how we bridge those gaps. And then equal, not better. The idea here behind accommodation is that the accommodation is only supposed to get you to a point where you are treated equally, but not better. So if you, let's say, for example, your job requires you to work every Tuesday through Saturday, and Saturday morning is something nobody else wants to work, and the request is that you need to have every Saturday morning off. Well, if that's perceived as being treated better, then that's not necessarily something that has to be accommodated. Now, that's kind of a rough example, but you can imagine that, a lot of people would probably like to have Saturday off. So are you being treated better and not equal to everybody else? The idea here is your employer should have these things clearly defined as the essential functions and should have a method for considering a reasonable accommodation. Job descriptions, as I mentioned. Every person should have a job description, and those job descriptions should clearly define the essential functions of the position. When you are applying for a job, this is some key information that I know everybody wants to hear. What do I need to disclose about my condition or my illness? And when do I need to disclose it? So these are all questions that are a little bit tricky, but ultimately it's pretty simple. If you do not need an accommodation at all, if you're able to do the essential functions of the job and you're not needing time off or anything, if you can navigate your illness around your job, then there's no reason or no requirement for you to disclose that whatsoever during the application process. Now, I do like to point out there's a little bit of a hard truth time here. So this is where I say, be honest with yourself. If you have a meeting with your physician, you have an appointment with your physician, and you're going to apply for a position, strongly encourage you to take the job description for that with you and make sure, maybe you've already had this conversation, know what you can and cannot do. Your employer can ask for clarification during certain circumstances and certain times, and ultimately they're probably going to ask you to provide that information. They're going to ask you for physician's letters if you're getting into an accommodation request. So at such time as you become aware of the need for an accommodation is probably the best time to first start talking about that with your potential employer. So let's say it's something simple like the need to leave 15 minutes early or something around infusion times, but you can still do the job. You just need to have a little bit of a flexible schedule. So maybe the position, everybody works there from 8 to 5 and you want to work from 7:30 to 4:30. That may not be a big deal. And that may be something that can very easily be handled. But you want to make sure that you can get that clarified right away if they specifically spell out that essential function of the job or the schedule of the position. Remember that as you're going through the interview process, this is, again, that sort of hard truth part where I like to point out from the employer's perspective. Just because you have a disability might not be the reason that they didn't hire you. You also have to be the most qualified person for the job. So this is a sort of tricky part about when do you disclose your situation? When do you disclose that you have an illness? Again, I'll point out, if you don't need an accommodation, there's really no reason to bring it up. Now, if at such point in time you do need that, then I would encourage you to go in with a level of certain honesty and transparency and go in with the idea that I want to come to my employer and say, I want to be able to continue to do this job. I want to be able to get this position. I am capable of doing the position and I'm going to do the position very, very well. I just need this flexibility. And that's where we start getting again to that sort of idea of the interactive process. Interviews themselves. I've had this question pop up to me before. Employers really try to do the interviews the same across the board. They want to have the same interview guides. They want to have the same questions asked, the same foundation. But if you need an accommodation for the interview itself, that's not a problem. You should be able to ask that, disclose that during the initial contact. A lot of times the initial interview starts with a phone interview. For somebody from the recruiting team would call you and go over the basic position, scheduling the interview. If there's something that you need from an accommodation there, that's okay to bring that up right then and there. Especially at that point in time, if it's something that really would be a requirement. Most organizations, I think, would find that they're willing to work with people on the interview if they feel like you're qualified. Okay. So again, very high level, and I'm looking at the clock, and we're 1 minute away from hitting our 25-minute mark. So like I said, we're going to go past that. Okay. Let's talk about your employer interactions and what you should expect. If you need to request an accommodation, employers should have a clearly defined process for requesting that accommodation. If you're unsure, check with your HR department. Most employers are going to have that spelled out somewhere for you, most likely in your employee handbook about what you need to do. One thing you can be assured of that they're going to ask for is documentation from your physician. So if possible, take your job description to your physician ahead of time. Your employer has the right to inquire about the condition as it applies to the performance of your job and its impact on your ability to perform the essential functions. So your employer should only disclose. So they can ask for this, but they shouldn't be shouting it from the rooftops. It's still a confidential thing. It should only be something that your employer shares very, very clearly defined people. So in most places I've ever been, this is information that's held very tightly by the HR department. So what would happen is you would be coming to your HR department, you'd be saying, look, I need this accommodation, whatever it is. They start this process of asking you about what exactly you need. You'll get your physician's documentation. They go through it. They determine that there's something agreeable that can be done. Now, again, the HR department may be your direct manager, but that should be about it. If anywhere beyond that, the fact that maybe you have a schedule change or there's something that's different, that should be fact, but not the entire organization needs to know that. So that kind of falls under the requirements of confidentiality and making sure that your employer is not shouting from the rooftops that you have a unique condition. Okay. All right. The interactive process. So this is something that's outlined in the ADA and EEOC. So this sets expectations that both the employee and the employer will negotiate in good faith to reach an agreeable outcome. If a requested accommodation is believed to be unreasonable, the employer should suggest an alternative solution. This is the back and forth. It should not just be no. And there's plenty of case law to support this fact. So it is possible that this process could go through multiple exchanges. So if I'm the employer and somebody comes to me and says, hey, I need every Friday off. And I say, okay, well, that is unreasonable in this circumstance. So every Friday off, is it really the entire whole Friday? So my first reaction is no, is it really all Friday? And then you come back and say, well, it's not every Friday. It's really, I need to leave by 2 o'clock every Friday. And I might come back and say, okay, well, that's still a little bit hard for me. What if we say you can leave at 2, but I need you to start at 6 o'clock in the morning? And you say, that sounds good. So now we've got an interactive process. We have an exchange. And so this should all be getting documented. This is the idea that the employer is supposed to work with you to find a way to make it work, but you as the employee also have to understand that it is give and take relationship. You know, we perform a task and we get paid for that task. So there has to be some give and take. So I will say this, and if I take anything away from anything I talk about, document everything and maintain your records. Your employer, I can trust you, is doing the same thing. So every interaction you have, document that. Every time you have an interaction with somebody and talk about this, write it down. Make sure you keep a hold of your information, because I can tell you again, your employer is doing the same thing. Okay. All right. So what are some other type of accommodations you may run into? So COVID. I know that we have had sessions already about COVID. I know that everybody on this call right now can talk about COVID being a horrible thing. What COVID did show us from an accommodation perspective was, though, that a lot of work can be done from home. And a lot of companies demonstrated that they're successful working from home. Now, there has been trends, and we've all seen this, of companies saying we want to go back to the office. There's things they talk about, camaraderie and that sort of stuff. But all the same, more and more, COVID has shown us that people can work from home. And so that may be a reasonable accommodation related to the position. And I think you may find that there are still a lot of organizations out there that have a largely remote workforce, or that have a partially or hybrid workforce. And that sort of opens the door for some of these interactions to determine what can be done and what should be done. The ability to attend large meetings remotely. So let's say, for example, you are comfortable going to the office on a regular basis. There's good social distancing. You know, there's a support for you wearing a mask on a regular basis. You feel like people are being, have that ability. But maybe what you're not comfortable with is hopping on an airplane, flying across the country to attend a virtual, session that's got 600 people in it, and that makes it a little bit uncomfortable. So maybe what that has to be is the accommodation could be the ability to attend that remotely if there is a virtual ability to attend. That's an example of a possible accommodation. Modified work schedule, leave to allow for treatment. So this is where we get into the FMLA aspect. FMLA and the overlap with the Americans with Disabilities Act. One other nugget I'd like to point out, FMLA for a long time was a hard and fast rule. It was basically, this is the letter of the law, and that's the way it worked. When the ADAAA came out, it actually stated that there are, or gave examples of some flexibility in the FMLA law as a reasonable accommodation. So the best example of that would be if you are in a situation where you have to have a leave of absence for some sort of procedure or something happening, and you're going to break that 480 hours. Maybe what you actually need is 520, but there's a hard date at the end. Then ADAA says, says that extra time, as long as there's a hard and fast end date, is a reasonable accommodation to the FMLA rules. So all kinds of fun little nuggets that go along with that. But again, that's kind of why kind of HR geek about the FMLA laws. Socially distanced workspace for support for the wearing of masks, gloves, or a face shield. You could have a workplace that, basically I think would say, we don't require mask, gloves, or face shields of all of our employees, but would certainly protect you from wearing one. If you decided you wanted to wear one, that would be permitted or allowed, and would also then sort of give you some protections from there being any sort of chastisement or problem with your coworkers if there was ever anything going on related to, I hate to think that this is a world we live in, but teasing or anything like that that could possibly happen, or bullying. But that's the kind of, support that your employer would give related to something like that. Okay, employer benefits plans. So what is my employer required to provide me related to benefits? I put this slide in here, and again, recognizing that maybe this is a longer presentation down the road. This could be something we could talk about for a long time. Social Security, Medicare, unemployment insurance, workers' compensation insurance, and complying with any sort of FMLA or similar state leave policies. That's really about all that's required. Now we get into the world of health insurance. So the Affordable Care Act applies to anybody that's more than 50 employees. And the Affordable Care Act said that it required applicable large employers, so more than 50, to offer adequate and affordable coverage to full-time employees and their dependents. Now, what I love about this is the applicable large employees, more than 50, it says, we have this thing called minimal essential coverage. So what does that mean? So this is an interesting term because the Affordable Care Act says the plan must provide minimal essential coverage. And if you look up the definition of minimal essential coverage, it says one that satisfies the Affordable Care Act. So we've got a little bit of a loop. So you go digging and you figure out what that actually means. Affordable under the Affordable Care Act means that the cost for individual coverage. So if I have myself, my wife, and my 2 boys, which I have, the only thing that really is used in that measurement is the cost to cover me. And my cost for my insurance can't be more than 9.12% of my entire household income. Now, how do the employers know what your entire household income is? They probably don't. But that's the nugget. That's what we're told. That's what we told her have to match. And then to reach what's called actuarial affordability, that 9.12% of cost has to then provide coverage that has an actuarial value of 60%, which means of all the services rendered, that the plan is paying for 60% of that cost. Now, I think if you do the math and you do some digging on that, that you'd probably find that that's a pretty wide road there. I mean, there's most coverages that are provided by your employer are going to hit that function or hit that functionality, hit that value pretty easily when you're thinking about its only individual coverage. So that minimum value number is something that I think most people don't have their head wrapped around, but I wanted to make sure I put that on the table here because I think you'd find most employer-sponsored plans are easily going to hit that, and especially when you think about the individual coverage. A lot of employees or a lot of employers pay a huge chunk for the employees coverage, but then maybe they pay a lower percentage for the dependents. It's just some math and things like that that you need to consider as you're negotiating, as you're evaluating whether or not your employer's plan is the right coverage for you. Obviously, there is a marketplace. You can go out and buy individual coverage, but usually your employer's coverage you're going to find is probably a little bit more affordable. So wanted to make sure we at least talked about that. A note on workers' compensation, unemployment insurance. I like to point this out as well. Unemployment insurance is basically if, and some states have pretty tight laws about when you're eligible for unemployment. So unemployment, and for some states, I'll use the state of Pennsylvania, for example, you're only eligible for unemployment if you have lost your position through no fault of your own. But if you are terminated for willful misconduct, you're not eligible to receive unemployment payments. So again, that documentation, being careful about why you're leaving a position. If you voluntarily leave and the employer says, look, the job's available, the person decided to leave, it wasn't our fault, you may not be eligible for unemployment. So be careful with how you document things and how you leave. And I can open up a whole can of worms about that. But again, just things to be careful of. If it's because of your medical condition, make sure you've got that documentation from your physician that says that you can't perform the functions of that job anymore. And that's why you have a compelling reason to leave the position. So all kinds of different things to look at here, but I wanted to at least introduce this topic, and maybe it's something we get into a little bit more down the road. Okay, so I'm going to throw a couple of frequently asked questions out, and then I'll answer these, and then we're going to open up the window to more questions. And I'll try and answer questions from the chat, and we'll see where that takes us. So first and foremost, I have PI. Does my employer have to let me leave work or let me work from home? So that's a big old maybe, just like we've talked about. What are other employees allowed to do? Are you able to perform the essential functions of the position if you are at home, or does your job have a requirement that you have to be in person for certain things? These are things where I would dive into, again, grab my job description, I'd read the details of the job description, make sure that it includes those essential functions. I would get information from my physician, consider what I really am and am not allowed to do, and then I would go right to my employer with that request for an accommodation if it really is not wise for you to be going in person to your office. If my job requires me in the office and people don't want to wear masks, can my employer make it mandatory for my coworkers to wear them? So this is one of those ones where I like to unfortunately point out, probably not. I don't believe that most employers are going to say that it's going to be mandatory for your coworkers to wear a mask because of a condition that you have. Now, would they obviously support you wearing a mask? That would be reasonable. Now, would the employer consider doing this? They might. Personally, as an HR person, I would say that it'd be very difficult for me to mandate other people wear a mask in that circumstance. Now, that may not be what we want to hear, but it's probably right. I have an interview next week. Do I have to tell them about my PI prior to the interview? This goes back to what we covered before. Maybe. If you can perform the essential functions of the job and you do not, without an accommodation, there's no reason for you to disclose it. The way I would put it out there is if you can do the job and it's not something that has to be disclosed, no reason to get into it. If it's something that comes up down the road and it's something that you have to do at that time, then fine. But initially, wouldn't even bring it up if you can do everything the job's asking to do. If I need to take my child for regular treatments and I don't want to lose my job, what do I do? Please remember, FMLA covers family members as well. And if it's regular treatments, that gets into the intermittent leave under FMLA, or look at your state leave policies. You might find that the state leave kicks in sooner than FMLA does, or for that matter, may provide paid leave versus unpaid leave. States can vary, but definitely look into your leave policies. I would start right off with FMLA, or even search for your state. Like you might search if it's Arizona leave policy and see what you find. Oftentimes, our government entities like to create these things called frequently asked questions or fact sheets. There's a ton of those out there, and they're a great cheat sheet. I know that my fellow HR professionals and we go those. There's no way to know the laws in all 50 states. So we go out to those quick hits and dive in real quick and figure out on the surface what we need to do, and then we have to go deeper, we do. But for the most part, you can find the information pretty regularly if you know what to look for. Okay. All right. So I'm going to go to the chat here real quick, and I'm going to see what we have in the chat room for questions. And there are a ton of questions here, so bear with me, and I'm going to pick a couple out here and read them. If we do not get to your question, I'm going to put my contact information on the last slide, and you are welcome to reach out to me, and I'm happy to at least see if I can get you pointed in the right direction. Let's see. So one question, so would an undue hardship ever include having to do twice the work because I have been unable to be there in person because of my various disabilities? I think way I'm taking this question is that because you're unable to be there, you're being assigned more work. That doesn't sound like an accommodation. That sounds more like somebody's giving you more work because you're not there. That sounds like the exact opposite of an accommodation. One of the undue hardship things that we run into would be, and maybe this is where this is going. If you've got a small team, so for example, you've got 3 people all doing the same job and one person has to be out for an extended period of time. Maybe that extended period of time goes past FMLA, and the question is whether or not we can accommodate that. you have to recognize whether or not you're asking the other employees to carry the weight and burden of the person who's unable to work. That's something that can be considered an undue hardship to the employer. Now, the other side of that could be the employer's need to hire a temporary employee. So the employer's coming out of pocket in order to accommodate a cost that they may have. Now, where that could get into, and this is why the interactive process come out, is, but maybe it's an unpaid leave. So they're not paying you, they're going to pay somebody else in that interim to do that job on a temporary basis. This is where we have to sort of explore that a little bit more and dive into the interactive process of what is reasonable and what would work depending upon the employer. The idea also has to come into how long will it take to train somebody to do your job while you're on that leave. So a lot of different things to consider. But yes, if you're in a small organization, which is why it's often harder for small organizations to have larger accommodations, if putting the work that you were normally doing onto somebody else could be considered unreasonable, but that's part of that exploration process that has to be done. Okay. All right, so we've got one question that was about masks. Can mask wearing be an ADA issue? My employer made everyone come back in the office, but accepted my request that I be allowed to wear a mask at times. However, now that the COVID emergency is over, getting pressure to stop wearing a mask because it supposedly makes customers, other employees uncomfortable. Obviously, you would not feel uncomfortable. I know my coworkers frequently come work sick. Can I make mask an ADA accommodation issue? So I do believe that that's a circumstance where, yes, if you have not already gone down that path, I would definitely encourage you to, if you have not already, sort of formalize that request under like an accommodation request. Whatever your employer has, that would be their process. I would work through that process. Then that's, again, go through the interactive process, go in good faith. I like to make sure I always point that out, but that's something that I would definitely encourage you to explore. And again, if that's one of those nuggets of, I'm not an attorney, but if it makes sense to you to do so, if that's the route you're going, it may make sense to consult with an attorney as well. But go first with whatever the process would be for requesting an accommodation through your employer. How are we on time? 4:42. So we've got time for a few more questions. Okay. One question is, how does one navigate small business and nonprofits? My employment history is 90% not big enough to hit the federal laws. I understand this completely. And what often happens is this is why there's the federal laws, and then some states reduce those criteria. So, for example, we've talked about FMLA, that's 50 employees, but the Americans with Disabilities Act only needs 15 employees. Dive into your state. So if there's FMLA, just as the one that's off the top of my head, or the Americans with Disabilities Act, do a search for your state specifically and for leave acts or state EEOC protections. You may be able to find that there are things that, even though you're in a small nonprofit, there may still be some protections. And let me also to come from the approach of, I do like to go at this with very strong positive intent regarding employers. I have worked with a number of employers, and I honestly and truly believe that every one of the people I've worked with has always come from the place of wanting to take care of our employees. And we really do go at this with the approach that we want to help. So you may find that some small employers have policies in place that, while they may not be, held legally to federal standards for these things, the employer still may have policies and practices in place that says they're going to abide by them, or they're going to do it. And if that's the case, you may find out that even though they're small, they're still going to try and work with you. I think some of our smallest employers often want to do that, and they want to, while not call it FMLA, for example, they may still want to have a policy that says, we'll hold your position during a leave of absence, and have an unpaid leave program. Or there are some small employers out there. I'll brag on IDF being one of them. We have a paid parental leave, and it's something that we're not required to do by law, but our CEO felt it was important to do that. So we have a paid parental leave program that exceeds anything required by the federal government. So a lot of small employers, take time to do that and provide some great coverage and great benefits. It's just something you may have to visit with your HR department and ask for. One question here, I'm not sure if all questions will be answered, but I want to throw this out. Should you be able to ask about insurance when applying for a job? If the company uses health insurance that does not cover my doctors, I would want to know that before going through interviews. I think that's very reasonable to ask. It's something that does not throw up a red flag for me personally when I'm interviewing somebody. The reality of it is in the world today, and for that matter, it also doesn't mean that I'm going to go digging for finding out why somebody's asking about insurance. I think that in the world we live in today, and people, I'll use myself as an example. I have a wife and 2 kids. I want to know that there's insurance coverage that comes along with the position, that I'm going to be able to protect my family. Now, does that mean that there's some underlying condition that's a problem? No, it just means that I want to make sure I have insurance. I think you would find even there that most employers, even on their employment side, are going to point out that they've got certain benefits. That may be like a beginning of second interview question if you go through the first interview and it's good. Or if you have a phone interview, for example, with one of the HR department, and you get through the end of the phone interview and you can say something to the effect of, I'm really excited about this opportunity, but let me just ask a couple of basic questions to make sure it makes sense to go forward. And you can talk about, I want to make sure, what's the waiting period for insurance? What's the, can you send me over the insurance coverage just so I can get a look at how it compares to my current employer? Or, those are all reasonable questions in today's day, and I think it would not throw up a red flag at all. Okay, and all right, some questions in here are a little bit specific, which I'd be happy to answer more one-on-one. Okay, I think that's all of the questions in the chat. I'm just making sure that there are any here that I missed. Nonprofits. Asking about job. So a question here that, and this one, there's one more in here that I want to make sure I'm understanding the question. It talks a little bit about insurance coverage, but the actuary accountability include things like specific diets, which many of us need to follow. So I think where they're getting at with the insurance is anything that's going to be billable to your insurance company. So it's probably most likely medical treatments. That's what you're talking about with the actuarial accountability for health insurance. I think that's the question. So if the diet is something that is prescribed, if it's something that's working through like a typical pharmacy, again, I would dive into that a little bit more specifically with your actual insurance and your medical coverage, but it could be grouped into that, but that could be very, very specific. And so I probably want to dive a little more into the specifics of what you're talking about there, but it's something that may fall into that world of actuarial accountability. Okay. Any other questions for the chat? Okay, then I'm going to advance the slide here. We're going to go on to the next slide. All right, so some key takeaways from today's session. And again, thank you all for coming today. Prior to applying for a position, strongly encourage you to approach your or approaching your current employer. Know what you can and cannot do. Have a conversation with your physician. If you have work restrictions, know what they are. Make sure you understand how your specific illness impacts your ability to perform essential functions of any position that you're applying for. That makes this entire process a lot smoother and easier if you know exactly what you're getting into. Follow your employer's process for requesting accommodation. Document, 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 document. Negotiate in good faith and expect the same in return. You want to go at this from an employer perspective. If you go in sort of a challenging or arguing or demanding, you put your employer on edge and they immediately put up defenses, when the reality of it is what you want to do is you want to be a good employee, you want to work hard for that organization, but you need a little help. And that's what that interactive process is all about. So be reasonable, demonstrate that you want to be productive and be a part of the team. And I think I've said this before, maintain documentation of all interactions with your employer, document, document, document. Because again, we're doing the same, okay? Now, some helpful links. I think this will be in the presentation, and you can find these. There's a Patient Advocate Foundation. There's a great link here. How the ADA defines someone as having a disability. This is something that you may want to look up some point in time. Job Accommodation Networks tool. This is something that helps define some accommodations. the enforcement guidelines for Title I of the ADA. So if you think you're having a challenge with the ADA, this sort of walks you through what those enforcement guidelines look like. And then back to Job Accommodation Network, helpful advice on appealing your employer's decision. So this is an example of you requested an accommodation, your employer said no. This gives you some helpful guidelines on how to appeal that decision on them saying no. All right, one last thing I have to do. I mentioned it earlier in the presentation that I am also the volunteer coordinator for IDF. I mentioned that we have over 400 volunteers. I'd like to point out that that number is probably more like 600, and we are always looking for great volunteers. I have a plasma ambassador program where we get to go out and say thank you to the plasma donors. We have got a health access advocate program. So a lot of great programs, whether it's visiting a local plasma center, lending caring ear to another. We have peer support, where if you're somebody that's been living with PI for a while and you're willing to talk to somebody who's newly diagnosed and help them through, again, we're not talking about medical advice. We're just talking about helping them, find a voice and understand, what's next for them. That's what our peer support program is all about. Get connected groups. You've probably heard about those in this session or in the meeting so far. Just a lot of different ways to get involved, and definitely encourage you to do so. You can always email me. I mentioned that I'll put my email address on one of the last slides, cduckett@primaryimmune.org. Director of HR and the volunteer coordinator, happy to talk to anybody, answer any questions you may have, help in any way I can. I find myself, just again, as I've said this before, overwhelmed and just so happy to be able to be here and be a part of this team and support this community, that whatever you need from me, I'm happy to help with. So thank you for being here, and thank you for joining the presentation, and I look forward to talking to everybody again. So this is the end of the presentation. I'd like to thank everyone for coming. This, as you know, probably heard by now, this is one of 39 unique opportunities for learning, and all of these sessions are being recorded. So if you missed one you want to see later, or you missed something I said today, you can go back to the attendee portal, go to the session, and you'll find that there's a way to watch it and record it. So thanks everybody for being here, and I look forward to talking to everybody again soon.